why some restorations fail and how to avoid it. So can an implant fail? The answer is yes, implants can fail. There are some things we know that can cause an implant to fail. We know that smoking and a history of smoking can be a higher incidence of failure. We also know that some new literature supports vitamin D deficiency as a #1 cause of implant failure. So all these things will be talked about and addressed during your consultation. Then there's some other things that can cause an implant to fail. We call these things like high occlusion, which is a fancy word for it's getting too high in your mouth and hitting too heavy when you're chewing and talking. So these are also things that we're going to address during your treatment to help avoid failure. Now, if an implant fails, which can happen, then we would take appropriate action. So option #1, we take that implant out, we clean it out, try to figure out what made it fail. We put a new implant right back in the same hole. Maybe we put an implant just behind it or just in front of it if that same spot isn't available. Or in some cases, we just skip it altogether. The treatment often is putting in more implants than you actually need to have a successful outcome, but these are all options that you and your provider can discuss during your treatment.